explain a little bit about today. We're recording this session for the House of Lords. They've got a Life After COVID inquiry, and they're collecting lots of evidence from lots of different people about what has changed in people's lives and what's more important now or what's less important now. And they're going to kind of collect that from lots of different people and write a report and some recommendations about it. So that's what we're putting this into. And they're also accepting like poetry and drawings and songs and videos and things. So if anyone's got anything more creative that they would like to send outside of this, I can send you the email that you need to send it to, because I'm sure some of you are very good at things like that. So yes, and my final thing before we really get started is that I know that for some people the pandemic has been quite difficult. So if we talk about anything today that is a bit upsetting or makes you uncomfortable, then you are really welcome to knock your camera off or maybe have a little break. If you do want to leave the meeting, will you let me know that that's why you've left, so that I can check in with you afterwards and that you're all okay. And yeah, so just make sure you let me know before you go. Oh, Natasha, you're showing me something.
Can you see it?
I can.
Good, that's good, very good.
I can't read it.
Good.
I'll show you what it says.
Yeah,
it says finalist. Natasha Nathan, your success as a finalist for the COVID Leaders, Disability and Autism Leaders list, in recognition of challenges you have overcome during self-isolation and the corona pandemic.
Oh, congratulations. It's very impressive.
Well done. That's really
very good. That's
really
very good.
Nice.
Good,
well done.
Very
so
nice.
it's a big award, isn't it? It's a recognition.
Natasha, who's it from?
Pardon? It's leaders.
Yeah.
It's recognize diminutions.
Dimensions.
Yeah.
Yeah, fantastic.
And I won't find out until I've run in October.
Yeah, that's very impressive, Natasha.
Wow, we've already started the session off with the certificate. Fantastic.
And yeah, and so I have to say thank you to you guys as well. So part of me getting this award, sorry to hijack it slightly, but part of me getting this award was because I went out of my way to help everyone like you guys. Like Katie helped me and then I returned help to you. So thank you very much, everyone.
Oh, no problem.
Well, thank you for being such a big help, Natasha. I think everybody appreciates all the things that you've shared with them. Yeah. Okay. Does anybody have any questions before we get started today?
I spoke to my social worker today, and they arranged me for new social care for me. Support called it Secret Angels from Luton, based in Luton, but they cover Central Bedfordshire and Luton. They're going to help me with my support service anyway for 3 hours a week.
That's nice. That's good.
That's good. Yeah.
That's getting sorted for you, Kev.
Yeah, because the social worker Central Bedfordshire sorted it out, and I thanked her for it. So I'm looking forward to it.
Good.
Yeah.
Good.
And I think I made a mistake when I cancelled HFT last time. Cancelled them didn't help, so I'm not going to cancel them this time. They wore the face masks when they came in visit me. That's what I did. I wore my face mask as well.
Okay, Becca, have you got one last point? Is it a quick thing before we get started? I know what you're all like, and we never get on to the questions.
Yeah, it's a very quick question before you start. Is that webinar still on the 15th?
It is, yes. Are you signed up for it? Do you need some help signing up, or have you managed?
Can't remember if I've signed up or not.
Okay, I will check for you and I'll drop you an email.
Okay. Thank you.
Okay, so the first question that they've put together in the pack is, how has coronavirus changed what's important in your life? Does anyone have any thoughts?
Been there.
Okay, if we go Kev first and then Natasha. Is that okay?
Yeah, that's fine.
I miss my brother. I can't see my brother in Japan. I can't see my family in Ireland as well. Got a family, got auntie, uncle live in Ireland, and can't see them, and I can't see my family cousin in Ireland as well, and I can't see can't travel anywhere on holiday I wanted to, and also miss the music concerts and also football matches as well. Watch Arsenal or the local team Stevenage or Luton. Yeah.
Okay. Thanks, Kev. Carl, I saw your hand, so if we go Natasha and then we go to Carl.
It's been an utter nightmare because they've somehow forgotten us in a way. People with learning difficulties and autism. That before COVID, it was bad enough to get help for our needs, especially like the Live Well, Live Longer campaigns, where they knew there was data out there saying that people with learning difficulties and autism die before their time, and I think they should have done something to put something in practice in all the major hospitals and all the major social services to highlight that we're going to need a lot more support instead of just seeing all negative things on the news and everything all the time. And then the fact that it was the information they gave was not so clear. It's been so hard to know what we're supposed to do and what we're not supposed to do. If we're harming ourselves, or if we're not harming ourselves, we don't know what is right.
I think it's been very difficult, hasn't it, Natasha?
Yeah.
Okay, so if we go to Carl and then Sheila, I've seen you've got your hand up.
Yep. Just not meeting family and stuff, and as from next Monday, we might be on another lockdown. England might be on another lockdown. As from next Monday. Which is annoying because we don't know why they're putting us on lockdown when there's no need to.
Is it your local area, you think, Carl, that's getting locked down?
Yeah.
Okay. And has that been confusing, do you think?
Yeah.
Okay. Oh, I can hear Ruth in the background as well.
Yeah. Hi, Rach.
Hello. Okay. Oh, hello, Gary. I'm glad you've got in.
Yeah.
Okay.
I struggled.
Sheila, did you have a point?
I think in terms of changing what is important during lockdown is the need for technology and the skills to use it, because so much has gone online, and the lack of affordable technology, affordable Wi-Fi, or even in some cases good quality Wi-Fi, depending on where you live. Because everything, they're already moving benefits and everything online increasingly. With libraries shut, there's nowhere for people who can't afford their own PCs. And the government said when the schools were going online, they were going to provide technology for those who couldn't afford it. And I didn't see the final numbers, but I know that there was a lot of criticism that they'd put the criteria, the basis on which you could get that, so high that hardly anybody qualified. But one of the things that I was asked to write a thing for a book about after post-COVID, and one of the things I said was that we needed a proper funding of technology, and if need be, that needs to come from the technology companies. Not just the government. If the technology companies rely on us and our information, they should also be able to pay and subsidize those who cannot afford. So I think there are ways of looking at that, but IT and technology is absolutely critical, both now and longer term, but it's become much more so because of social isolation and so much online.
Thank you, Sheila. I really agree. Mark, you've got your hand up.
I have, and I've just realised there's a new layout on it on the map. I just trying to, yeah, technology is one, getting broadband, affordable broadband, and also that is still is a continuation from before COVID, during COVID, and obviously it'll be after COVID. But I think certainly that is a question mark. Now a lot of people are now deciding to know, well, not deciding, now they're coming online, like now there's more people coming online a little bit, one or two more members, for example, in our groups and stuff coming online. Some are still struggling how using Zoom. So it is, so even though we got like a slight of the face-to-face thing there, that can be okay. But again, now that I think the more concerns I think we've got, I've certainly got now, and I think everybody else may agree, that the rule on Monday is all of a sudden that it seemed to just come out of nowhere, and in the group of 6, and they're claiming that it's going to affect a lot of people, young people. Actually, it's going to affect everybody, and I think, people just, looking at numbers, looking at charts and stuff like that, and trying to get the tests done and everything. That's not just the answer. And I think, I think we definitely need a lot of disability awareness changing in this. For example, during the COVID, and then even now, social distancing is still here to play. Wearing a mask if anybody is unable to get one, to allowed to use one, is still here to play. Support services, from my, I've got learning disability, visual and hearing impairment, but the bottom line is, there's, for example, Sensing Change and with the base in Ipswich, they're still not, giving people the support. Whereas I know in other parts of here, and as well as in somewhere like Wales as well, some people have already still got that, even when you've got social distancing to play. So it's still very, very hard. So yeah, I definitely think some things within the government and also local authorities need to have that discussion, because it's gonna be, by the time it gets to December, we're talking about another 2 more months. It's got to be about 2 or 3 more months after, and then you've got the new year, and then you're still going to say, well, I'm not going to get any more support. Well, or I'm still not going to get support because of COVID. Come on, something's not quite right. So I think, never mind the future of other stuff. Let's get this, let's get this down. Let's get this proper, and find out actually what is happening in everybody's area, rather than them presuming and saying, "Oh, I don't know." It's still, it's still difficult, because they blame people on, not blame, sorry, but they're using people like elderly people or people in higher priorities. I get that, but that was ever since March. So what about people who got additional other disabilities? What about people who always had their support? And what about us paying for support to them now? Don't have to pay anymore. That's fine, but then that wiped out all the support. Now I used to pay for my support, then I readjust the support package so that then I don't pay any. But then that means one problem, that they're not coming. So it's very interesting movements on it. So we'll see what the future holds. I hope there will be some positive, but you just don't know. Again, it's back to that.
Thanks, Mark. If we go Gary, then Sheila.
Yeah, I went to to Barcelona, not just for a holiday. It could have been a holiday, and I had a conference meeting over 3 days, and in Spain and in Belgium, the government pays for people with disabilities to have free computers.
That's incredible.
Yeah, that is
Very good.
incredible. Yeah, so that happens, and it doesn't happen in the UK, you know, and it's criminal, really, and I think that's got to change, and we've got to have different types of computers, like touch screen and voice activated, because some people can't write. So we got to have different types of computers for people's different needs.
Sorry, I just want to pick up on that free computers thing. Even when I was at school, there was a way they were saying that they were going to help free computers. Definitely in some schools now and in universities, if someone is dyslexic or has additional needs, they have to have an assessment, and if the assessment says that this person needs X, Y, and Z, then they are given a disability grant towards the equipment that they need to help them study, and that includes computers. Because I know that, because my son, who is 22, got diagnosed dyspraxic, and he just had the care assessment last year, and if he had to drop out of university, not because of COVID but for personal reasons. But if he had carried on, he would have got help, a free computer to suit his needs, and then every other thing he needed.
Thanks, Natasha.
But people don't know about it.
Mm-hmm. Sheila?
I think something else that became very, very clear was the need to change the status of social care, but also, as someone already said, the focus so much of the debate was around the NHS, which was right, because they were fighting, they were providing the emergency care. But what was lost was any mention of learning disability or any other form of disability, the long-term care that is needed within social care. That was, the recognition of what social care covers, it has become increasingly important, but also the need to address the debate about how we're going to fund social care has become even more of a crisis during the pandemic, because it was made so obvious that it was the poor relation. It wasn't getting the money, it wasn't getting the recognition. The NHS, it wasn't getting the equipment. The NHS were getting huge amounts of money, not enough equipment, admittedly, and they were nearly overwhelmed, but they were the ones that kept getting all the recognition. And social care was very much the poor relation, very much second-class citizen. And then within that second-class citizen, anybody with a long-term care support need, or only sort of lower level support needs, but the essential lower level support needs that make life practical and doable, they just got completely lost in amongst the discussions around the elder care in care homes, and the range of social care that goes on. And what we need to do is give social care the same kind of status in terms of how the public see it as the NHS. The NHS is this sort of mythological, wonderful thing, and it is a wonderful thing, but social care is just as essential, but it's not given any kind of similar status, and that needs to change. One more point and then I'll stop. And I think, given that I'm a parent, although my son no longer lives with me, the role of family carers and other informal carers or relative carers, and in whatever status they are, I think got totally lost. Their care and support, a little like you were saying, Mark, in terms of things just disappearing, no information, money that you were paying out for things not getting refunded or not getting redirected into care support that you could use directly, a whole host of things. There were some examples of good flexibility, but this one size fits all, very rigid thinking, lack of adaptability and lack of engagement and support for the informal carers was very, very poor. And I think that really needs to change, and that was highlighted very strongly by the fantastic work they all did, but the pressure that it's put families under is the other side of that. I'll stop.
Thanks, Sheila. Andrea, did you have your hand up before? I think you were first. And then if we go Carl, Becca, Natasha after Andrea, is that okay? Great.
Yeah. I'm lost with what your original question was, Rachel, but I think it's what happened, you know, during COVID for us. And I think following on from what Sheila said, you know, the whole digital poverty thing was, you know, every single day we had to address that. But the whole communications thing, I think that whereas all the self-advocacy organisations have to really have a, you know, massive congratulations for what they've just done. I mean, you know, without fail, everybody has pulled it, you know, out the hat. They've done really amazing things. But I don't actually think it should have been left to organisations that are on the whole not funded or poorly funded to actually get that information out to people in a way that's accessible to them. And we all did that. I mean, we all came together and we all shared as much as we could. But I don't think that that is how it should have happened, that people were forgotten and information was sent out that, you know, most people struggled to understand anyway. And then organisations like the one I work for, like the ones represented here, had to then interpret that, and then they had to battle through a digital poverty wasteland to try and get out to people and let them know, as well as trying to use, you know, you make more phone calls, you know, nobody could visit. And I think the isolation that people were thrown into was just terrible. And the fear that we saw was really, really frightening. And the other side to that is that there was a great coming together of all like-minded people and like-minded groups, and everybody, the support was overwhelming, I think, in those areas. So, but again, for a lot of those people, it was just out of their beliefs and their principles, and you know, and just being nice people. And I think you shouldn't rely too much on that when you're talking about something as serious as life and death. You know, it shouldn't be like that, and that's what we were faced with. So I think there needs to be, it would be really great, I know this is part of an inquiry about what actually happened, but I think it'd be really great to get some groups together to really talk about the detail, because it's always the devil's in the detail, isn't it? It's always those, what really happened and then what happened and why and what happened then. And just saying, you know, people didn't have computers isn't enough. It's about what happened because they didn't have one, or what did happen because they did have one. You know, those two are equally valid things. So I think we need more conversation, not just presenting things to people, but more conversations with people, so that, you know, they've got real people that it really affected. And, you know, I hope that this will only just be a start, and then people will start actually recognising the great things people did, as well as the things they were unable to do. Yeah, so.
Andrea. So I think we had Carl, Becca and Natasha, and then if anybody has anything else to say on this question, would you put it in the chat or will you send it to me afterwards just so we can make sure we get on to the next questions? So if we go to Carl next.
I don't know if the government have made it clear enough when we first come out of lockdown, when the whole of England come out of lockdown, just how important it was. Because what I'm getting is care homes for people with learning disabilities and the elderly are still on lockdown. They've been on lockdown now for 18 months, since March of this year, and they're still on lockdown. I thought everybody were off lockdown, and well, it seems to me care homes have got different. The government give different rules to care homes rather than the general public. Is there a reason why that's happened, or?
I think part of that, Carl, might be that they're trying to keep lots of people safe, because if lots of people live together, it makes it a bit more difficult. But I think you make a good point that we need to remember about everybody. That's really important. Becca?
Yeah, the worst thing about the pandemic, because I have really struggled with it, especially when it all kicked in, is when you're on my level, when you used to go into that many things, some social, but some that help your well-being, like a 12-step program, and then the lock shuts, it's all like took off you, being robbed with everything. And yeah, it's good that Zoom's replaced a lot of things and we can get out a bit more. But like just being said with care homes, supported living, it's different for all of them. Different care providers are doing different things. Ours is still in a full lockdown. Now I've just been told today, because I've got another meeting coming up soon, but I've just been told by the manager that she's gone to her manager now and said that they could try and risk assess my mum and dad coming in my flat and social distancing. They can't guarantee they can come in. It could get turned down. But
Mark says,
you know, however many times you say that, and my mum and dad are like, well, yeah, but you know, it's because different rules. I mean, the place across the Geno from us that took out a lockdown, it's got people that have been on like ATUs, that criteria across the road, that came out of lockdown a few months ago. But this is supported living, is not a care home. And we're actually held back, apparently, because there's a couple that don't understand social distance, so everybody else has got to suffer through them.
Yeah, I think that's really difficult, isn't it?
It's different rules for different people and different rules for different providers, and it's like, should it be like that, shouldn't it?
Mm-hmm.
You know, they should all be singing from the same hymn sheet. You know, if they're out of lockdown, they're out of lockdown. If they're still keeping people safe, they keep people safe. They need to all say the same thing. And it's also confusing that it says that you can meet with 6 people after next week, no more than 6 outdoors. But on a website that I looked at, it says that in Sheffield, we're not included in the latest restrictions on a website. So that's very misleading as well.
Thanks, Becca.
Well, can I just, yeah, that certificate was also signed by Scott Watkin, the co-chair of behalf of Learning Disability England.
Mm-hmm.
And so what I wanted to say is that I stopped clapping for the NHS. I thought the NHS were worse than social services. All they were putting on, we heard throughout COVID for people with learning difficulties and autism, is how they were putting do not resuscitations on us, and that they stopped people who were inside hospitals going to see us. And sometimes even when, because I've done a lot of research on it, that's why I've got that. And even when it was deemed that they shouldn't put the do not resuscitate forms on them, they still did. And the only reason that they did that was because we've got learning disabilities or autism. And they didn't even see an autism nurse, they didn't even, or a learning disability nurse, they didn't read our passport. And I think, we're just treated like dogs. And I'm sorry, but I can't. I said to someone who works in Learning Disability England, I said to them, I'm supposed to go into hospital because because I've got other health conditions that need monitoring, and I'm scared, and I'm even more scared now. So I'm scared you're going to murder me, and this is not going to go away. And I've put one of the things that I did to get that award is I kept writing to my local hospitals and saying, you need to put something out to say that your hospitals are still open and you're sorry and that you care about us. Otherwise, you're not going to get us back. Come autumn, when we're supposed to have our flu jabs, and when we're supposed to have a care assessors plans, make sure we're all well, nobody's going to want to go. So it's not social workers really, it's the healthcare, because the healthcare should know that. And that's what makes me sad, sorry. I'm a mother as well, and it's really hard. Sorry.
Yeah, that's okay, Natasha. I think you were right to be sad and cross about that. I think everyone in this group would be pretty cross about it. Thank you for raising that, because I think that's a really important point that we need to make. Sheila, did you have your hand up? Is it a quick one?
Yes. It was picking up on Natasha's very important point about the DNAR, because don't forget, we'd got the report that we did based on a number of providers that Learning Disability England have done, which is good, and it explores those issues, and I think it's not now as widespread as it was, but I think what it does raise, and this is something that will be even more important after the pandemic, and I've heard yet again more recently examples of nurses, sometimes learning disability nurses, often just ordinary nurses, who have said things like, oh, and when did you get autism? Or when did you come down with autism? And so the need for training around communicating with people with autism, with people with learning disabilities, but also so that people are helped to, and this may help you, Natasha, feel less fearful, so that you go in with your own very clear description of how you want to be treated when you're in hospital, and if you do have to go, so that those on what helps you when you go in there, so people have the support in their hand, so that there is no room for oh, well, we didn't know, or we thought, or whatever, if it's very clearly stated how you should communicate. But I think training around learning disability and autism and good communication is absolutely critical. That's within the NHS, and at the government level, and that goes national government, local government, and as well in providers, is regular and clear and consistent communication. And I think people's comments now make it very clear that this constant changing from one set of rules to another is very, very difficult. And what you were saying, Becca, unfortunately, sometimes it's not possible to have one rule for everybody because different circumstances need different responses. But it's making it clear why there are those differences, you know, so that if we can understand why, we're more likely to go, I don't like it, but okay, if that's why, I'll do it. But if we're just told, oh, now you're going to do this, we're going to say why. So clear communication and consistent communication and training, absolutely critical.
It doesn't work like that. The training is there now. They're doing training. The doctors were making their own rules throughout COVID. They didn't always follow it.
I think there is training, Natasha. It's just not
it's
enough.
Just, I know
it's not enough, and it's not being followed through.
Can you just let me finish, please?
Yeah.
There's some more training just being launched. It's just come out just recently, I know, because I took part in it. And when someone goes in, when it's an emergency, it's different than when you go out as when you are an outpatient. When you go in there as in an emergency, you're not able to hand over your passport. You're not able to communicate with the nurses and the doctors and tell them what you need and how you need help. Because sometimes you're not even able to talk, because I go non-verbal. If I go as an outpatient, it's different. So I'm autistic. I only did, and one of the reasons why they asked that question about how when did you find out I was autistic, I'm 46 now. I only formally found out I was autistic last year at the age of 45. So it's not always a clear question. Some people find out in different ways, through different, but that question, like some people find out because they are having a test to find out if they're dyslexic. So they find out they're autistic as well. But the nurse doesn't know how to say it properly. But anyway, you've got to move on to the next question. Sorry.
All right, thank you, Natasha. Okay, so for the next bit, we've jumped in a time machine and we are now 2 years in the future. So it's 2022. And I want us to all think about what has changed when we're in that year. And has COVID made us live our lives differently? Are different things important to us then? Andrew.
I think we'll probably just go back. I think everyone just go back to normal.
I know.
Even now people are going back to normal now, which it shouldn't be, because unfortunately, young people just don't care, and they think, oh, I'm not going to get it, so I'm fine. But they not realise they pass it on to vulnerable people. So.
Okay. Thanks, Andrew. Kelly?
I can say what I'd hope to be implemented, because obviously, like Andrew, I'm a little bit skeptical, but I hope that one of the things we do keep is stuff like working from home and everything has made a lot of things more accessible. And so I have mobility issues as well, but I've been able to access stuff online. I know we did talk about people not being able to be digital, but on the flip side of that, I'm able to do more. Now I can do some at home because of my other conditions and because I'm also autistic. So I don't have to make eye contact with all of you right now. And that is actually something that's making me a lot more confident. So I hope going forward, we realise that workplaces can be more flexible and we can be more accessible as a community and get good work from people or good contributions from people without having to push them into the box of working 9 to 5 and that kind of thing. I hope that it's kind of shown us that as a community we can still keep going with that.
Thanks, Kelly. I think that's really important. Sheila, did you have your hand up?
I think one of the things is what are we assuming? Have we got a vaccine? Let's assume we've got a vaccine and we've got a testing system that works. That might be a flock of pigs that are circling overhead, but flying. But let us assume that. I think that's the critical thing. But I think building on what Kelly was just saying, with people working from home and some of the sort of volunteering activities that went on and local communities helping vulnerable people or helping out in the community, I would hope, I'm not convinced that it will happen, but I hope that we will see a shift to the way in which local communities work together, and that you get much more sort of things all together in a community. So you get food shops and people living and areas where you can walk easily and traffic-free areas. You're beginning to see this with streets being closed and more pedestrian areas. And I think that could be a really big opportunity, because you could create spaces where people become familiar faces within local communities and therefore are not sort of stared at as being odd, or I have an autistic son and he looks perfectly fine until he does something very strange, which he does on a regular basis. But if he's known within the community, and where he is, he's becoming known in the community, it's just a case of, oh, there's Edward. Oh, that's all right. You know, he's just having one of his days. You know, he's having a bit of a flap or whatever. And he's just accepted. And I think there is an opportunity for local communities on a really local level to begin to work together. And that would be a fantastic, but that needs changes to planning laws, to traffic, to how we build shops and houses in the same place. So if high streets are dying, well, put houses in the high streets as well as the shops, and you have it all in together. You know, there seems to be very little creative thinking. So local communities.
Great, thank you, Sheila. Mark, and then if we go to Gary after, and then Natasha.
Certainly, I think we have to look at balancing things out a bit more now. And when you look at 2022, you think, oh my goodness, and it just shocked me by the time you said it. So I was thinking, well, it's going to be quite, yeah, like what some people have been saying about the vaccine and stuff. I think, and certainly more around what is around, you know, the social aspect of life definitely need to be there a lot more, not just out and about, and hopefully that would improve, because actually a lot of people now, you know, at the moment we're on our computers, we're TVs and smart stuff and whatever. But I think one of the things we're missing as a community is actually meeting together somehow, and actually do what we used to do. I know people might think, oh, we're talking about the 80s here. Well, partly in the fact that you can just balance your lifestyle a little bit. Because I think what happens is more and more people, whether it's through the pandemic or not, were more kind of like isolated. They didn't have very good neighbours and stuff like this. I just think that now there need to be some attitude changing in the fact that, you know, people to get on with their neighbours, or people to get on with people, especially if you're going through an emergency situation, through mental health or whatever other disabilities you've got, as well as, you know, learning disability and sensory impairment, etc., and like what I've got. So it's around that. Oh, just loads. I think accessibility got to be the very top priority through everything, from computers, making sure that all the website, all the documentations, you know, not just through disability services, but through everything. That I'm hoping that dream will come true, because if it isn't on a computer where obviously it speaks out, but it's also large print and maybe a lot more flexible in the accessibility guidelines, and especially around things like COVID, because we don't know how long COVID will last for. They're predicting 2 years, but it may, we don't know. It just depends on how people treat it. But I think after COVID and all that, I think there will, not to say that there would be any form of virus thing, you just don't know. The bottom line is getting that access information clearly from the top. And then, better from the top. I think what we've found in the last 10 years within governments at the moment is the fact that there's all of it is just like confusing messages and complication. From what I understood, they all talked about just money. That their guide. Yeah, money's one thing, but it was also about, someone mentioned about pedestrians and that kind of thing. It's a hard one because that's to do with safe space. So I think it needs to be recognised with people like with learning disability with visual impairment, for example. At the moment, they're doing the shared space quite well, but it's not really marked very well for other people to sort of like, you can't kind of just all have a walkway. So it needs to be kind of balanced, but also at the same time, it's very, very difficult to establish, sorry about the noise, establish the a path and a road. So where it used to be just a pavement and then a road and then it's another pavement on the other side. So I think that kind of needs to be rethinked again if the government was doing that. Because shared space can be very, very difficult, because especially if the bike comes along, not many people could hear bike. Maybe they need a bell or something. I don't know, but something that recognised, because some of it might sound old, but at the end of the day, it might sound quite useful. Those are some of them for now, but you could just go on that question, Rachel. But there we go. That's all I've got for now.
If you've got anything else, Mark, stick it in the chat, and then we can make sure that we send that too.
Oh, so okay.
I think we said Gary after that, and then Natasha.
Yeah, I was just going to say there probably be about 8 different types of COVID vaccines, hopefully by then. Yes, and also there would be to have all those inoculations will be done by the armed forces, so the army, the navy, also police will also be giving us injections. It'll be on a big scale. We're talking about loads of people getting these injections. The government says vets will be in that as well. So, and yeah, so also, I'm also thinking about green issues. We need to convert the building
that's right.
into a cheaper and accessible, affordable, and we've got these offices which circulate the air from in the building, so it doesn't really get rid of the COVID. There needs to be a better air conditioning system if you're going to have people returning back to the offices and work. And for me personally, I'm missing kissing and hugging and having romance, and that's what I'm that kind of person. I miss having all that happening in my life. So it's I like to touch people.
Thanks, Gary. Natasha, did you have something about what you?
Yeah. Can you hear me? Because I'm using my headphones.
Yeah.
Yeah.
Right. I think when the start of this thing that is happening, when they have quiet hours for people that for all types of disabilities, the elderly, is a really good thing, and I think that they should keep that all the time, because some people really hate shopping when there's big loads of crowds of people, and so I think that that's a good thing that they should carry on keeping, and maybe find a way to make it progress. Like one of the organisations that I work with was trying to do something called See the Person First, where it was training for the all shops, businesses and supermarkets to see the person and not the disability. So it helped train the whole of the staff to how best to help someone with a disability. We wanted to launch that before COVID, but it never took off. And I think that would be really beneficial, because like, especially now, it's like you go, I haven't been in big supermarkets yet because I'm too scared to go back. But even now, you're even more scared to help someone. Do you know what I mean? If you ask for where's this, before they will go and find it for you, but now you're scared to hand it over and things. So maybe a way to like progress it so it makes everyone safe. And also they're wanting to do bike lanes as well. That might be a good thing, because that might also help those with wheelchairs as well. Maybe they could find a way to adapt the pavements to help wheelchairs as well if they're doing bike lanes, because I thought then people with wheelchairs and those scooters will be able to get around more as well. So that's my thoughts.
Thank you, Natasha. Does anybody else have any thoughts about what changes they hope to see in 2 years' time? Sheila? And then
I've just put it in the chat box in case I didn't get a chance, but it's changing the status of caring roles, whether those are informal care or formal care, so that they are valued in a way that formal skills are valued. At the moment, they're not seen as high status jobs. The immigration criteria show this very clearly, because if you've got a low paid job, you're not seen as valuable, and yet the care sector is the highest employer of overseas employees, and most of them earn under the salary level. And the crisis, the levels of unemployment may mean that lots of people suddenly reevaluate working in the care profession, but they've got to have the right attitudes and the right skills. So that's one thing. And the other thing, which I haven't put in the chat box, is that suddenly people are having to rely on universal credit and other benefits, who traditionally never go anywhere near being on the receiving end of benefits, and are suddenly saying, ooh, £90 a week isn't very much. It's very difficult to live on £90 a week, isn't it? Well, surprise, surprise. So the fact that new groups of people are suddenly realizing how low benefits are, that could lead to change, and I hope it does lead to change, and that political memories are not so short that they don't do anything about it.
Thank you, Sheila. Becca?
Yeah, it would be nice. One of the things, if you're on the autistic spectrum, it would be good to keep the social distance to a certain extent, because when you're in a queue and somebody's right up your backside and you're having to turn around and say, oh, excuse me, just move back a little bit, please, let me get served. But especially the one 2 metre, maybe 1.5 metres, because it means people aren't invading your space, and they teach them a bit what we're living with every day when people overcrowd you. So not completely social distance where people but whereas if it's like in a crowded area that would be crowded, keep the social distance in them areas and on transport.
Thanks, Becca. Andrew?
Yeah, on the transport, Becca, even I went on the tram yesterday, on Tuesday to the, yesterday, the tram was extremely busy, and in no way was the social distance, I had to get off. So, unfortunately, when everything's going back to normal, things will still be as they were. So, yeah.
Thanks, Andrew. We're coming up to 4 o'clock, and that's when we said we would finish. And there are other questions, but you guys have bounced around over them really and covered lots of the things. So I wonder if we want to finish it in a couple of minutes, and if anybody's got any final thoughts, you could maybe add them now.
Okay.
Has anybody got anything else to add? They think that's important, that they say what the future they want it to look like. Sheila. Oh, sorry, Natasha. Go off to Sheila first.
A universal basic income that is actually a living wage, because the levels of unemployment that are coming not only post-pandemic, but also because of changing technology, so that people can live and do other things as well to contribute. This contribution is not just through paid formal work. We contribute in many ways.
Thanks, Sheila. I think that's really important. Go on, Natasha, and then to Gary.
My one thing would be that for the people who don't have a mummy or a daddy who are adults with learning difficulty or autism or any type of disability, to make it easier for them to be able to know the law, be able to contribute to their lives and get the best quality of life they can be, and make it easier for them, especially if there's any changes which they need to know about, like there was a new COVID rules that came in place. And I think if you've got a mum or a dad or a carer fighting for you, it's really different than if you're having to do it yourself. Because I'm sorry if I'm passionate about all of this, but I've had to really grow up this last few months because I'm doing everything really myself, and looking after my son as well. And I think moving forward, I would like to hope that there'll be a way to make it easier for us, or if there's people who are fighting, especially when they're fighting, when the children are fighting for the future, a better future for the adults, because we have it for life.
Natasha, I think that's really important. If we go to Gary and then to Kelly.
Right, I was thinking about why not employ people with learning disabilities and autism to work in the care and health. You know, there's a lot of people that probably would like to look after other people similar to themselves in the care and health sector, because they're, you know, we've got people with learning disabilities and autism looking for jobs, you know, well-paid jobs.
Gary, Kelly.
Just to kind of sum everything up, I think it would be great if the government would stop treating people with disabilities, learning difficulties, autism as a second thought. I would really like it if, you know, when people are putting things in place, that's considered as a given. It's not just, oh yeah, we have to look after them as well about a week later or however long later. Really, that would be great.
Thank you. Any other final thoughts for today?
I think there should. I think universal basic income is for a better system. Make sure that people with disabilities don't be in poverty, and if they get assessments, if they can lose the benefit, So there's not been a lot of disabled people commit suicide because they lose the benefits and lose the income. There's been some few deaths of that, which is worrying.
Thanks, Kev. Any more before I round us up? Nope. Great. Thank you very much, everybody, for sharing your thoughts today. I think we've got lots of really interesting things to submit there.